You don't start with me. Today I would like you to take a moment, imagine yourself breathing in and out of a small straw. Are you going to capture that next breath? This is the fear you deal with when you have asthma. My own experience with asthma helped with the decision to do additional research. According to the American Asthma Foundation, over 23 million Americans have asthma. This is more than cancer patients or coronary heart disease patients. Today I would like to explain what asthma is, the symptoms, some things that trigger asthma, and various ways to keep asthma under control. You may ask, what is asthma? Well, it is a chronic disease affecting the tubes that carry air in and out of your lungs. These tubes are called airways. Asthma patients have two main problems. First, airway constriction. The muscles around the airways of your lungs squeeze and tighten together. Second, inflammation. If you have asthma, the airways in your lungs are always inflamed. When inflammation increases, it can produce a thick mucus, causing additional obstructions for the airway. Conditions that can trigger the two main causes of asthma are the common cold, respiratory infections, cold air, food allergies, physical activity, emotional stress, and the most common trigger is allergens like pollen or dust. When your asthma is triggered, you may have some of the following symptoms. Feeling short of breath. This happens because the air can't get out of your lungs, so there's not enough room for the fresh air to get in. You could have tightness of your chest. This feels like someone sitting on your chest, and it can be very uncomfortable and quite frightening. Wheezing. It's a whistling sound that happens when the air moves through the airways because the airways are swollen and inflamed. Coughing. This happens because your lungs are trying to get rid of the things irritating your asthma. According to Consumer Reports Health Issue, coughing is the most common symptom in children. Another trigger of asthma can be laughter, according to an article from Science Daily, a study at NYU Medical Center by Dr. Stuart Garay. Out of 235 patients with asthma, 56% had laughter-induced asthma. No one knows for sure how laughter brings on asthma, but it might involve hyperventilating. Dr. Garay suggests that laughter-induced asthma may be a sign that a person's asthma is not well controlled. The study found that the most common symptom in patients included asthma, and laughter-induced asthma was coughing, which generally started within the first 2 minutes. I could have easily participated in this study. Laughter seems to bring my asthma on quite often. This brings me to the two main types of medications. First, the long-term control medication. Most people who have asthma take a long-term medicine daily to help prevent symptoms. The main purpose is to reduce inflammation, which is the key trigger to preventing asthma attacks. This is my controlled medication I take daily, and it's called Advair. And you push the lever to get the measured amount of medication, and then you inhale it into your lungs. The dosage is 1 puff twice per day. The second type of medication is a quick relief medicine, also referred to as a rescue inhaler. The inhaler relaxes the muscles surrounding the airways to ease coughing and shortness of breath. This is an example of my rescue inhaler. It is Proventil, and you insert the tube in your mouth, release the measured medication, and hold it into your lungs. And you repeat this process. This prescription is to use as needed. If a person with asthma finds themselves having to use their rescue medication often, it could mean that their asthma is not well controlled. Anyone who has asthma should always carry their rescue inhaler. So again, long-term medication helps prevent the symptoms, and the quick relief medication is used to stop asthma symptoms. When asthma symptoms become worse than usual, it's caused an asthma attack. During an asthma attack, an individual may appear to be gasping for air. Most asthma attacks are relatively mild. During a severe, or referred to as an acute asthma attack, the airways can close so much that the vital organs are not receiving oxygen. At this point, asthma can become life-threatening. According to the National Heart, Lung, and Blood Institute, you should seek emergency help if your asthma attack is not responding to your rescue medication, if you're having trouble walking or breathing walking or talking because you're out of breath, if your lips or fingernails are turning blue. If hospitalized, it is likely you will be given oxygen and additional medications at a higher dose than you take at home. It is possible you will be given a shot to help reduce the swelling quickly. The exact cause of asthma is unknown, but it's possibly due to genetic factors and environmental influence. Asthma left untreated can cause severe or permanent damage to your lungs. In conclusion, asthma is a chronic disease of the airways in your lungs. Unfortunately, there is no cure for asthma. Asthma is in your lungs whether you feel it or not, but it can be controlled with medication. Asthma triggers, severity, and exact symptoms are different for each person. So if you or someone you care about has asthma, I encourage you to discuss a treatment plan with your doctor to determine what plan works best for you.